All yours. Let me know.
Okay, and will you put the slides on?
I will do it.
Okay. So don't be afraid of these slides, you guys. I'm going to go very slowly and explain everything. Okay, so I'll get started now. And the first point is on part one, we talked about simple kind of human ways, if you will, to augment happiness. And they were helping others and joining with others together, being grateful, meditating, slowing yourself down, meditating, sleep, exercise, being out in nature. They were human kinds of things, normal kinds of things that are relatively easy, let's say, to do. And what I wanted to do in this lecture is to take it forward, not just those human factors in happiness. And we discussed happiness is such a funny word. It's peace, comfort, all kinds of things. But what I wanted to do is now take those factors forward to talk about those factors in disease and how with illness those factors can really help you. And I wanted to give some data, some medical or scientific data to make my points. And I'll go through them carefully and slowly, and then we have time to discuss. So next slide, please, Gary.
I lost control of my machine.
Okay, I see it. I see the next slide, like up with all the people on my right.
Gary,
Yeah.
do you have two monitors?
No, I only have one.
Oh, okay.
Let's see. Let me see if I can escape. Oh, where was that? Okay, next slide.
Yes, you did it. Mazel tov. Okay. This is a painting by Sir Luke Fildus. It's called The Doctor, and it was painted in the 1800s, the 1891. And there's the doctor. He's been called to take care of this young patient. He cares about her. He's looking at her. He cares for her, but he doesn't have a black bag, and he has no medicines at all. And the fact is, we have never had Western medicines, the medicines that we know about. It's been less than 100 years that we've had any of them. So as an example, penicillin was first discovered in 1929, but it was first used in 1945. Prior to that time, we had no antibiotics, we had nothing, we had no medicines. And yet he was called to the bedside. And so were all of these healers, shamans, medicine men, whatever we call them, throughout every single society, generation after generation, century after century, we've had those healers, and they had no medicine. And my concept is they had to be effective at what they were doing. They had to be successful, or I wouldn't be here today, and the medical profession would not be here today. They were doing something that peace, that caring was important and did something that was recognized by all of these societies. Now I want to talk about what is that, what are those things. And I'm going to start with, next slide, please. I'm going to start with a study, and don't worry about the words there. I'm going to explain things and just walk through it. But this was a study of people who all had coronary artery disease, and they all had angiograms to prove that they had narrowing of the coronary arteries and they were clearly at risk for getting heart attacks. And they wanted to see what kinds of factors could predict who was going to get in trouble in the near future and who was not, who was going to get another heart attack or a first heart attack, and or who was going to die. And they put into the analysis all kinds of factors that might be important. Some of those factors were traditional kind of medical things. For example, what were the exact heart risk factors? What was the force of contraction of the heart? How strong was the heart able to contract? That's called the ejection fraction. They looked at the specific angiogram results, just how bad was that coronary artery disease. They looked to see whether the patient had angina or not. They looked at many of these factors, and they threw something else into the equation. They looked to see if the patient had a spouse or a confidant, i.e. a spouse or a friend. And they put all of that into the soup, so to speak, to figure out which of those factors was independently on its own capable of predicting that that person was going to have a heart attack or die.
My skin.
That's called a multifactorial analysis, big word. But what it means is this. Let's just say you're making chicken soup, and we're going to put all of these ingredients into the soup to try to figure out which of those ingredients independent is associated with what it tastes like, the chicken taste of the chicken soup. So we're going to put into that soup water. We will put chicken. We'll put maybe chicken bone broth, a little of that. We'll put carrot. We'll put celery. We'll put salt and pepper. Which of those things independently is going to give us the taste of chicken soup? And my bet would be it's the chicken and the chicken broth. Carrots alone are not going to make chicken soup for you. So you're putting everything into that soup to figure out, and then we're statistically going to figure out what of those ingredients stands out statistically as independent risk factors for that outcome, in this case, a heart attack or death. Next slide. So they looked at all of those factors, and many of them were important, as you would expect, but it turned out one of the very weighty things to predict whether that patient was going to do well or not was whether or not they had anyone around them. And what you see on the bottom of the slide there, that's time, years of follow-up, and on the up and down, 198, that's the estimated survival, how long did they live? And the people on the bottom graph are those who lived the shortest amount of time, statistically shorter. They died of heart attack or something else. And those were people who identified that they were not married, they had no confidant, no friend. And in the other groups, they seem to be going in the same direction, much better than the others, but similar to one another. And that group were married with a friend, unmarried with a friend, married but no friend, some combination that somebody is around you. So that is a carefully done medical study showing that for some reason or another, having a friend or being married allows you to do better, to live longer with known heart disease. Okay, next slide. This is another study, similar, putting all these factors into the soup. This one was 1,500 patients, and they were looking, what they put in is not just married and have a friend, but are you living alone or do you live with others? And the chance of the first recurrent heart attack or death over the first 4 years, if you were living alone, you were far more likely statistically to do worse, to have another heart attack or to die, as opposed to whether you were living with other people with you. So again, something about other people around you and doing well or not doing well with a heart attack. Okay, next slide. This is a study of people with HIV infection. And first you get HIV, but you don't necessarily get AIDS for a number of years, a decade or so. And they were looking to see whether the HIV infected people who were stressed did worse or any difference between those who are not stressed or stressed. And this is the risk of not progressing. So if you were not stressed, you were statistically not going to progress to AIDS. If you were stressed, you were more likely to develop AIDS and develop it faster. So something showing stress not good for you in the setting of HIV infection. Next slide. This is an interesting one. This is a patient of mine, and she had malignant lymphoma. And what we're looking at is her CAT scan, and this was March of 1989. And at the end of the arrow, you see kind of an amorphous blob. I can't point it. I'll try. You can't see me pointing. But in any event, it's that whole blob around that arrowhead. And on the toward the bottom, there's a spinal cord there. There are 2 kidneys, and then this mass. And it's behind her belly. It's behind her stomach in her belly cavity. So there's that big malignant cancer, lymphoma. Next slide. And that's March of '89. Now, that's June of 1990. And what you see is there is no more mass. It's gone. It's totally gone. Gary, can you go back and then forward again just to show that again? Okay, there it was. And it's hiding a blood vessel that you'll see in a minute. Now go forward again. Okay, it's gone. So you would have concluded that basically I used one of my magic medicines and she's much better and it was a good medicine. And the fact is there was no therapy at all. No drugs were used, no radiation, nothing of that sort. I used my words. She was frightened as could be. She was anxious as could be. She was living alone. Things were difficult for her financially and every other way. And I just kind of lowered the temperature in the room. You're going to be okay. It's all right. It's all right. I'll be here. We're going to work on this together. You're going to be okay. And in time, she relaxed. She got better. And she really did get better. That lymphoma went away. Well, one could look at that and say it was a miracle. It was a miracle. And if it was only one, then yeah, maybe it was a miracle. But Gary, let's see the next slide. As it turns out, this is not a miracle. And this happens 20 to 30% of the time with this kind of cancer. So let's just take the, 25% of the time, let's say, there is a spontaneous remission of that cancer. It goes away. I'm not saying it's a cure, but the average duration is like 15 months. But there's somebody who's out 72 months and still this thing has not come back. There's nothing as good as that. It's very cheap. There's no financial toxicity. There are no side effects. Now, what is that all about? Well, this was from a paper by Horning and Rosenberg, Saul Rosenberg, and it was published in the New England Journal, 1984. Saul Rosenberg was a very well-known, very well-respected lymphoma expert from Stanford. And Stanford at that time was a major center for the care of patients with malignant lymphoma. So let's just set up this scenario. And I've said this at big medical meetings with Dr. Rosenberg in the room, so don't worry, he's heard what I'm going to say. In any event, this is the scenario. Let's just say the patient is in the middle of the country someplace, in some little town, and he has a big lump in his, big lymph node, big lump in his neck. He's scared. He goes to the doctor. Doctor says, oh, we better biopsy that. Don't know what it is. They biopsy it, and it is malignant lymphoma. And at this point, the patient is focused on the word malignant. And as far as he's concerned, he's dead. He's gone. And he's scared to death. And he says to the doctor, what are we going to do? What are we going to do? And the doctor says, I'm going to send you to Dr. Rosenberg. You'll go to Dr. Rosenberg down there in California at Stanford. He'll give us some advice, and I'll follow his advice. You come home, and that's what we're going to do. So the patient goes to Stanford, is seen by Dr. Rosenberg, has the same kind of malignant lymphoma that I showed you on that CAT scan a moment ago, big lumps and bumps all over the place. And Rosenberg says, well, what we're going to do is nothing at all right now. We're just going to watch and wait. I'm going to see what's going to happen. I think you're going to be fine. And maybe eventually you'll need treatment, but no, you're going to be okay here. And I don't want to treat at all. You don't need to be treated. You go home and I'll keep, every month or so your doctor will get back to me. But I think you're going to be just doing fine. And in that setting of peace of mind, as opposed to scared to death, something happens, I say. And I'll tell you what it is in a moment, but something happens biologically, chemically in your body to allow that tumor, that malignant cancer to go away. And again, I'm not saying it's a cure, but it goes away, and sometimes for a long time, on average for more than a year. So some of these human kinds of things, speaking carefully, kindly, softly, getting rid of some angst and frustration and fear, they do something. Being around other people does something. This is getting kind of interesting to me. hopefully to you too. Next slide. It's not just magic. This is the same kind of thing in an animal system. So this is a study of mice, and what happens to the mice is they are injected with cancer cells into the belly cavity. And after they get these cancer cells, they are randomized. They're separated into two groups. One group is stressed, and the stressed mice are stressed by putting them in these immobilizing them, putting them in these tiny little cages that they just can't move, and they get stressed. And the other group, they're just walking around the normal cage and so forth. They are not stressed. And what happened is they did CAT scans on these mice after about a month. And this is what the CAT scans, and then later they sacrificed the mice and showed that that was the cancer. But on your left where it says control, i.e. not stressed, yeah, there's a tumor there. But look at the size of the tumor of those animals that were kept in that confined place. It's 2, 3, 4 times bigger. And if they were not killed to sacrifice for the next group, died much faster than the control group. So it can't be, touchy-feely men thinking or humans thinking. This has to be biology. Something's happening there. What is stress, and what's stress doing that's not good for us? Okay, next slide. Now these are bigger studies, and these are studies that go through big populations of people with various kinds of illnesses. And move closer so you can see this one. But this study was done by the World Health Organization, and they have a way to assess the average health status of a country or a community. And they have all kinds of questions and hospitalization, all the data. And they did this health survey in 245,000 participants from 60 countries. And on your far left is the average health status of people in general, of these 250,000 people. And it's like 90.6, that's the number. So I guess there is no such thing as perfection in average health, but it was 90, let's say. And now you start adding various diseases. So first of all, that first one is asthma. So when you have asthma, that knocks down the average health of that group. The next is angina, that knocks it down. The next is arthritis, that knocks it down. The next is diabetes, that knocks it down. Now you go to the next, which is depression. And that's just depression, no other illness, depression. But the average health score goes down lower than any of those medical illnesses just with depression. Now let's continue right. The next one is depression and arthritis, even further down than arthritis or depression alone. Next comes depression plus angina, then depression plus asthma, then depression plus diabetes. So whatever the health condition, if you add depression to it, it gets worse. And then on your far right, we have 2 or more chronic conditions, and that gets you to a mean health of 71.8. And now depression and 2 or more health conditions, and now you're down to 56, and that's the lowest. So again, on this huge population study in 60 countries, so it's not a society-related kind of thing, depression is not good for you. Okay, let's go to the next slide. This is, let me explain it. So this is the same kind of idea. It's looking at various conditions, medical and otherwise, and what conditions lead to decreased lifespan. In other words, decreased survival. And as you go to the right, those boxes to the right, those are the levels of decreased survival, less lifetime with these various conditions. And so starting on the very bottom, it says air pollution, low versus high. So if you're living in a high air pollution area like we are, there's a little hit there on survival. It's not good for you to live in smog. Next is treating high blood pressure versus not. So if you have high blood pressure and you're not treated, you won't live as well. The next is whether you are obese or lean. And obesity, again, is associated with shortened survival. I'll move up a little bit. Vaccines given or not, that's kind of in the middle. So if you don't get vaccines compared to those who do, you will live a shorter amount of time. Going up 2 more boxes, if you are a smoker and you stop smoking versus you don't stop smoking. If you do not stop smoking, you won't live as long. Now we're going to go to the top 3 bars, and those are the most interesting. And the bar number 2 and 3 are consumed together in the top bar, and that says overall social relationships. And if the overall social relationships are not there, survival is decreased, is statistically decreased, more so than not treating blood pressure, not getting vaccines, not stopping to smoke. Social, we need people around us, social relationships. Okay, next slide. This one is looking at a meta-analysis. It doesn't matter, but it's a huge, they're looking at all the articles that have been published involving 77,000 subjects on the effect of loneliness on all-cause mortality, on death. And each line is a different study, and the line going down in the middle, that's no effect. And anything to the left of that line would indicate that study showed that loneliness reduced the risk of death. Okay, it was good to be lonely. And everything to the right of that line was the study showed that loneliness increases the risk of death. So again, a huge study showing the same kind of thing. We need people around us. It's not good for us to be lonely. Okay, next slide. Well, not everybody has a spouse. Not everybody has a friend. That's okay, as it turns out. And the question is, can support from an external source affect the outcome in cancer patients? And I use the cancer patients because that would be the most difficult kind of thing where these soft things might mean something. So let's look at that. Next slide. This was another study from Stanford by David Spiegel, and he was looking at the role of support groups on survival, on the quality of survival and the amount of survival. And all of these women, there were 86 women who came into the study, they all had metastatic breast cancer. They were matched for prognostic factors, how big was the cancer, all of the medical kinds of things around the factor. So they were the same in that regard. And they all had the same usual medical care. This is at Stanford, so they had outstanding, quote, usual medical care. And they all had that from the same doctors, and they were followed over time. And at the beginning of the study, they were randomly assigned to one of 2 groups. On your left, 50 of them were assigned to have to go to a weekly hour-and-a-half support group. And they wanted them to go for a year. There were about 7 to 10 women in each of these support groups. And the other women, the 36, the control women, had the same treatment, same doctor, same everything, same disease, but no support group. And first of all, they looked at kind of emotional things. And they had done all of these depression scales and loneliness, all of these careful instruments and questionnaires that have been proved and validated to be correct in years ago. And so when they did these mood disturbance scores, it turned out that the women who were in the support group did better over time, and the women with the same disease but no support group did worse. They looked at pain, how much pain were these women had. It decreased over time in those who attended the support group, and the pain increased in time with those who did not have a support group. Next slide.
Live longer also.
Yes, that's it exactly. You got it. And the support group, if you look at the lifetime, first of all, if you take survival from onset of study to death, the control group lived for, all rounded off, lived for 19 months, and the support group lived for 37 months. And that was highly significant. Next slide. And this is what it looks like on a survival curve. So as you can see in the top curve, this is the probability of survival over time. And those that had the exact same medical disease, the exact same care, the exact same doctors, the exact same treatment, but attended a support group, lived statistically longer. And that study has been repeated and validated again. So it doesn't matter if you don't have a friend, but I'll say as part of this group, you do. That's what High Neighbors is all about. This is a support group. This is bringing all of you together. This is an important group. And it's not just because it might make you feel happier or better. It's going to be, it will help you in a medical way also. This is an important kind of a thing. Okay, next slide. So this relationship between, I'll call it social support and clinical outcome, why? So maybe it's just common things. Number one, improve medication adherence, actually taking the medicines. And the reason I say that is because of me. I take some pills, but every Sunday, Victor, my husband, gets out my little pill box and he puts all the pills, Monday, Tuesday, Wednesday, Thursday. And then all I have to do is crack open the little, thing of the day and take them. He makes it easier for me. So maybe having someone around you can help you with taking your medicines, reminding you or filling your pill box or whatever. It could be just something as simple as that. Number two, maybe it's the improved ability to comply with all requirements of therapy. So pills are one thing, but you have to get to the clinic. And if you're all alone and there's no one who can drive you to the clinic, you're going to miss some doctor appointments. And so, there are appointments for scans, for doctors, for this, for that. If you have somebody around you, they can help you get to that appointment. The third says maybe it's just a healthier lifestyle if you have somebody around you. And I say that because of one of my personal experiences as well. I have a very good friend, Jean, and when I left USC to go to City of Hope, we organized that we would just meet once a month. I didn't want to lose her as a friend. We would meet once a month for dinner. And one of those times after a big, bulky dinner, as we were trying to get up from the table, she said, why do we have to meet at dinner? Why don't we just walk or something? And that started us to walk. And right now we walk once a week, and maybe I'm going as much as 5 miles each time, but I wouldn't have done that alone. It's hard to do it alone. And healthier lifestyle may be one of the factors that is related to this, having somebody else around you. Improved coping skills, just talking something through with somebody, it just helps. And I think that could be part of what's going on. Better emotional peace, maybe that's part of the coping and so forth. But what I really want to go on to could it be something other than all of these kind of normal things? Next slide. Well, I'm going to say yes, it is due to something else. And there are several possibilities between this mind-body connection. What might be the biologic, the real medical link between this loneliness and stress and depression and so forth, and not doing well physically. So let's talk about the immune
Vivian,
system.
it's Lee. It's 4:30 and I promised I'd be down in a half an hour, which was 3 o'clock. I got between the telephone,
Okay.
and the computer, and then
We will go on to immunologic. Gary, could you flip the slide?
when I get down there, and my apologies.
Okay, so now let's think about this. Stress, depression, and loneliness on the left side have negative effects on health and well-being. That's what we've just gone through. But importantly, those same emotions are associated with weakening of the immune system. Okay, that if there's one slide I would want you to remember, it's this slide. Okay, next slide. Now, what is our immune system? It's a system of all different kinds of cells, and that immune system is responsible for keeping us safe from foreign invaders, keeping us safe from germs, bacteria, viruses, and even keeping us safe from cancer cells. Our immune system should see that a cancer cell is foreign to us and destroy it, just like it sees that a germ is foreign to us and destroy it. So there are many, many cells as part of the immune system. What you hear most about is lymphocytes and T lymphocytes or B. So a T lymphocyte is a type of white blood cell. It is responsible for recognizing a foreign invader, and it directly kills that foreign invader directly. And I'll show you how it does it in a minute. B lymphocytes, they also kill the foreign invader, but they do it indirectly by making a protein called an antibody. And the antibody surrounds the foreign germ or foreign cancer cell, and the antibody destroys it. So these T lymphocytes and B lymphocytes are critically important in your immune system. But as you'll see in a minute, there are many other cells as well. Next slide. Don't worry about this. I'll just say it really quickly. How would stress, loneliness, depression weaken the immune system? How would it do that? And I'm not going to walk through every little part of that pathway other than to take you first on the left side of stress. So stress on the right side goes into epinephrine, flight and fright. And that's going to weaken the immune system, but I won't go through how because it's difficult to explain. You just believe it for a minute. But on the left, the stress also goes through your brain, and that leads to your pituitary gland, and that gives messages to your adrenal gland, and the adrenal gland makes glucocorticoids. It makes cortisone, and the cortisone kills lymphocytes. It kills them. So that's your immune system, and that stress through the glucocorticoids, through the cortisone, is killing the most important part of your immune system. So that's easier to understand. There are other mechanisms that I won't get into, but the bottom line is stress, depression, loneliness weakens the immune system in a very specific ways. Okay, next slide. Now, what is cancer anyway? And basically, cancer requires at least 2 errors or accidents to get us in trouble. Number 1, an error, an accident at the level of the DNA. So remember, the DNA is the pearl necklace, and there's an error, there's an accident in one of the pearls, one of the little beads on that pearl necklace. And that accident comes from radiation, comes from smoking, the chemicals in smoking, comes from, many times, most of the time, we don't know where, but there's an error that occurred once you were born. Not that you're born with it. It's not genetic. You acquire an error. And that error says to the cell, you never die, and you're going to divide, and you're never going to die. It turns out that every cell in the body has a normal lifespan. So for example, red blood cells live 120 days. And at the end of 120 days, there's a chemical message that says to them, it's time to go. It's called programmed death. The cell dies and a new red cell comes to replace it. So red cells live 120 days, not forever. A kind of a white blood cell called a neutrophil lives 6 hours and then dies and is replaced. So every cell in the body has a lifespan. And what this does, what that error says, you are not going to die. You're going to live forever. You're going to divide, and never die. And the tumor gets bigger and bigger and bigger. So that's the first thing that's required for the cancer to develop. But the second is extremely important. A failure of your immune system to recognize the error, to recognize that this is now a foreign cell to you, and to destroy it. Okay? So you need an immune system to keep you free of germs. You also need an immune system to keep you free of cancer. Okay, next slide. This is a photograph. It's another cell. It's not a T or a B lymphocyte. It's something called a macrophage, another cell in your immune system. And that orange stuff on top that it's gobbling up is TB. It's eating a TB. It's going to digest the TB germs and kill them. You won't die. The TB is going to die. And this is why, we've had antibiotics, as I say, since 1945, but people didn't all die of pneumonia in 1944, not at all. And that's because they had an immune system to help them. And the antibiotics is going to help even more, but you have that for this purpose. Okay, next slide. This is another cell in the immune system. It's called an NK cell, a natural killer cell. It's the cell with the arrow, the kind of bluish, purplish kind of cell. And the yellow thing above it is a cancer cell. The natural killer cell is capable of recognizing, and it's making attachments. I can't show you, but there are little lines there. It's attaching to that cancer cell. It recognizes it, sees it it's foreign, and it's going to kill it. And it does. It punches a hole in it, and there's that dead on the bottom, that dead cancer cell that isn't there anymore. Okay, next slide. This is a T lymphocyte in yellow. And the pink thing is a cancer cell. Got another photograph. And you see an attachment again. It's attaching to that specifically. It sees something that it doesn't like. It sees something that it's foreign. And it's going to attack it, and then it's going to kill it. Next slide. This is another picture of these cytotoxic T8 cells, so T lymphocytes, bunches of them, all gathered around another cancer cell, attacking it, and each one attaching very specifically. And it's going to kill that cancer cell also. Next slide. Don't worry, you don't have to know any of that stuff. How does it kill it? Well, there on the bottom is the activated T cell. It sees that foreign thing, and it starts shooting off all these chemicals. One of the chemicals is called perforin, and it perforates the cell surface. It bites a hole in the surface of the cell. It's not going to be able to live with a hole in its surface like that. It has other granules it's going to release. It has all kinds of other chemicals. So it punches a hole, and it puts all of these chemicals into the foreign cell, in this example, the cancer cell, and all of those chemicals, after the punch in the gut, so to speak, in the skin, so to speak, will kill that cell. And it does. They do kill the cell. That is what they do. Okay, next slide. So again, what we've been doing in the past in trying to cure or treat cancer, number one, we can't, in the past, we haven't been able to do anything about that error in the DNA, the accident. We can do something now, and I'm not going to go into it now, but that's genetic engineering. Some of these fancy-dancy kinds of things, CRISPR technology, going in and literally cutting out. For example, sickle cell disease is one gene that's wrong, one little amino acid on one little gene. And we have the ability with this CRISPR to go into the DNA to literally cut it out and throw it away, that bad gene. So I'm not going to get into that anymore. But what we have used to treat cancer in the past is something that will kill the cancer cell. We're going after the cancer cell. And the cancer cell is dividing faster than anything else. So we develop these drugs that will kill any cell that divides fast. Cancer cell divides faster than anybody else, it's going to be affected. But there are normal cells in the body that also divide fast, like that white cell, the neutrophil. It lives 6 hours. You have to make up every single one of those cells 4 times a day to survive. And those cells are going to get knocked down by chemo also. And that's why people get infections, because their white cells go down. But that's nonspecific, all kinds of side effects. Now the future is number 2. Can we augment the immune system of the host to recognize that that error is there, to recognize that that is foreign? And can we use the immune system, the person's own immune system, to treat this cancer? That's what the future is. And that's what I'm going to talk about in a more comprehensive way on part 3 of this. But we've changed entirely our understanding of how we can treat cancer and some other diseases as well. Okay, next slide. So this is one of the most prominent, respected scientific journals in the world, is something called Science, believe it or not. And this was Breakthrough of the Year, Cancer Immunotherapy, T cells on the attack. That's where science is going. That's where medicine is going. And it's the beginning, but there's been massive explosion in information and knowledge and new drugs and so forth just in the last 2 or 3 years. Okay, next slide. So let's go back to the future for a moment. There is the doctor again. Was the peace of his presence augmenting the patient's immune system? These doctors, these healers called back 1,000 years ago, 500 years ago, 100 years ago with no medicines. They had to be doing something. Was his presence enough to get rid of some of that fear and allow her immune system to kick in? Next slide. My hypothesis, peace of mind, is a type of immunochemical therapy. I don't know, can you do the next slide? I don't know whether this came across or not, but there it is. And what I mean by peace of mind, less stress, less angst, human interactions, social relationships. I think that is a type of immunotherapy. And we've now come to understand that. And we've now come to use that concept to actually develop the drugs that might work at the chemical level in the same way that those human factors work in a chemical level. Next slide. So what I will talk about next time is what is that immunotherapy? What are they talking about with checkpoint inhibitors and CAR T cells and all of that? How do they work? And what the future is now. So what is this future and what it's all about? So I will stop now and let's discuss questions, answers, whatever.
Okay. Here we go.
Great. So what do you think? Does it make sense?
Can
Yeah,
I say something?
sure,
know,
Ray.
Okay, hi, everybody. I just, I live by myself. I don't want to go into any home. My house is small enough for me and I'm comfortable. And I have neighbors, I have relationships here that are just unfounded. I mean, everyone checks on me, looks in on me. One of the neighbors will call, we're walking by with the children, will you come out and wave? They want to see their grandma Ray. And I have a neighbor way up on the corner. I'm going to, every 2 weeks, they go to Costco. What can we get you? And across the street, Elsick, my darling neighbor across the street, Ray, I'm tired of being in the house. What can I get you at the store? I have to go shopping, please. I mean, these are the kind of people that I have around me. And I think it's so good. And my kids don't have to worry about me. Jane lives, up in Morro Bay, and Beth has her own family and her own things that she has to do. But she always makes sure that she takes me to the doctor. And I feel very, very comfortable being here. Thank God I'm still well enough to, to take care of myself.
To be there.
So,
but you're bringing up a very important point that I'd like to emphasize again. It doesn't matter. I mean, it matters, but if you don't have a husband, if you don't have a friend, and if you didn't have the neighbors, you have high neighbors. And my point is, this is no joke, this group. It's no joke at all. And it works, it's a support group. And every support group is different in what it's giving to support. But we need people around us. And it doesn't have to be spouse people. And it doesn't even have to be good friend people. We just need somebody around who cares. And you care as well. One of those things on happiness was help others. One of the ways to augment your happiness, help others. So it goes in both directions, actually. Yes, Rabbi.
Lois. You have to unmute, Lois.
No, who wants? Okay, who wants a question? Ingrid, no, scratching her eyes.
I was going to say, stress reduction techniques are very important, correct? And getting enough sleep and exercise, good nutrition and a mindset, and that's sometimes that can be difficult, a mindset, if someone who's going through difficult times, you can be there, and without being
Yes.
intrusive. But, you know,
Yes.
there's that fine line, you know.
So, so the easiest way to do it is just to be really honest. I want to do anything I possibly can to help you, but I don't want to bother. Do me a favor. I'm gonna do X, whatever you're gonna do. But you please be honest. Just be honest, because I love you and I want to help. It's so easy just to let your heart open and just say the truth, because the truth is you want to help and you care, and you just don't want to, be overbearing or whatever the word might be. And I started this, I decided to go in these 3 different topics because everything you just said there, how do you reduce your stress? That's what we talked about on the first thing. Walking with somebody, getting out and exercise, helping somebody, being grateful. All of those quote unquote little things aren't so little, as it turns out. And they aren't so little in making you feel quote happier, or more at peace. And they aren't so little in helping you to do better with illness. It's amazing. They aren't so little at all, those various things. So you're right. All of those things will reduce stress. Exactly right. Yeah.
What about
Yeah,
COVID?
Barbara.
No, Rabbi is ready.
Okay, Rabbi.
What about COVID and the mind-body reaction to that illness?
COVID and mind body, that's a really interesting question. One of the problems, to be honest, there are 2 huge problems with COVID and mind body. The first is, and this really happened to me, so I know it happens, foggy brain, just not, you can't concentrate, you can't, I don't know, you just can't get your act together, just diffuse thinking, fuzzy, foggy thinking. And so that makes it less likely for you to kind of know what you're doing and get your act together and all of that. The other thing that was so horrible was loneliness. You couldn't go visit the patient. They were all alone. And, as I've shown, it's the worst thing in the world to be all alone. And they were. And that was so horrible, so sad. And you read these stories like at the LA Times on Monday, talks about several of the people who died, and the comment always from the family, always, he was alone, she was alone. And so those 2 big things were probably very, very weighty in not allowing what normal kinds of immune functions might get augmented. It was harder. I wasn't thinking right. I really wasn't thinking right. And I wasn't able to, I remember, I would force myself to be, I'm awake, it's morning, morning came, there's a new flower, it's alive and so am I, I'm alive, I'm alive. I would repeat those things to me, trying to get myself focused, but it's hard to do. And there weren't other people, I was at home, Victor was here, but in the hospital, there isn't anybody to help you. And the nurse and the doctor are kind as could be, but they're wearing shields and masks and, all of that. There's no warmth, there's no hug. And, I can't prove it and I don't really want to even, but I'll bet you that lack of the simple things, quote unquote, certainly did not help in any means at all, and probably made things worse for the patients with COVID. It was hard. Yeah, it's a good question.
Barbara?
I'm not disagreeing with anything you're saying, but I've heard people take a different perspective that having to control your own attitude puts a lot more pressure on the patient they are more responsible for their illness, and it can spiral more into a depression or a feeling that I'm responsible for my sickness. So I'd love to hear your response to that kind of.
Yeah, I think that's a really interesting point and an interesting issue. And I'll do it with a story of a patient I had many, many years ago. She had Hodgkin's disease, and she came in with, she was an artist, a ceramicist. Anyway, she had very advanced disease. She kept, right from the very beginning, she kept saying to me, listen, I am so positive. I am positive. I will beat this. Do not even think about me. Do not worry about me. I'm the most positive person you've ever met in your life. I will beat this. No problem. And she got chemo. Everything went into a remission. And like 2 months later, right away, it relapsed. She had very serious itching and lymph nodes 2 months later. And she said, and first I saw the itching. I didn't want to say anything, but I knew what it was. And I was so upset. And I asked her to come back the next week, and it was clear what was going on, the big lymph nodes and everything. And I said, I think it's back. And she started to say, I failed. I wasn't positive enough. And that taught, she didn't fail at all. The chemo failed her. She didn't fail. And that was the last time I ever asked a patient to have positive thoughts. That's not what I ask. What I ask is, what gives your, what puts your soul to rest? What relaxes your soul? Don't tell me now. Go home, think about it, come back. Tell me what relaxes your soul. And I need you to do that as much as you possibly can. For example, I need to hear the sound of the waves. The sound of the waves in the ocean relaxes my soul. And when I'm depleted, I go to the beach. I need to. What relaxes your soul? That I need. I don't want. I'm going to beat this. I'm positive. That's a wrong. You can't beat cancer that way, and it leaves the patient very often feeling that they had failed, when under no circumstance did they fail, and it's such a horrible. I'll never forget that moment that she said to me, I failed, and she meant it. She thought it. So I agree with you. I'm not disagreeing with what you said, not at all, not at all.
Many years ago, I think I was attending my brother-in-law's graduation from medical school at UCLA. Norman Cousins spoke about how he went into he spent all his time watching, I think it was I Love Lucy, and just
Yes.
happy thoughts. Is that related to what you're talking about?
Yeah. So that was in the first lecture, laughter, smiling, I said, but it was really smiling and laughter is one of the 10, scientifically proven ways to augment your happiness. But it increases your natural killer cells. It increases endorphins. So increasing natural killer cells with laughter means that your immune system is augmented. That cell that was killing the cancer cell there. It releases endorphins. That takes pain away. Laughter is huge. Cousins is absolutely right. And what we now know is that's chemical. It's chemical. It's not magic. Mother Nature, God, really made us beautifully complicated, more so than we could ever understand. But I said this the last time, I'll just say it again. As an example of that, we have tears. And sometimes you cry because you're, the death of somebody. And those tears have all of these stress chemicals in them. That's the composition of really sad tears. In other words, the person says, oh, I had a good cry, I feel better. Yes, you do feel better. All those stress chemicals just left your body. And then there's going to the movie, and it's a sad movie, and you cry at the sad movie. That's saline. There's no stress chemicals in those tears at all. So, Mother Nature has given us all of these ways to deal with anxiety and stress and so forth. And it's so fascinating if you kind of stand back and look at it all. So yeah, laughter works. And it's not just magic. It does some chemical things to you because God made it that way, I guess.
They say laughter is the best medicine.
Well, it's one of them. It's one of the 10. I agree. and it's cheap, no financial toxicity, no other side effects. Yeah, exactly. And when you said I love Lucy, in the AIDS epidemic, you know, I spent my life taking care of, a good part of it, taking care of AIDS patients. And they all watch I Love Lucy. I mean, I can't even believe it. I've heard this about 1,000,000 times in my life. I'm okay. I watched I Love Lucy last night. It's funny. Right. Okay. Other questions, other thoughts?
Yeah, does the severity of the cancer and the point at which you're diagnosed have an effect on what you're talking about? For example, I know someone, and so do you, who was recently diagnosed with a glioblastoma, a really serious cancer, and I believe she's stage 4. Part of what's happening with her, and maybe this is a good thing, a side effect, is that she doesn't understand. It doesn't seem as though she understands how serious her condition is. So when you say to her, how are you feeling? And I try not to say it in a really serious, ominous voice, she'll say, oh, I'm fine. I'm doing great. I'm really feeling fine. The chemo pill I'm taking hasn't made my hair fall out, so I'm fine. So what is your reaction?
So I'll say 2 things. Number one, at a certain point, biology wins. Glioblastoma is a horrible disease. It's a horrible disease. And there are some new ways to try to think about treating it, and we'll talk about that next time. But I can't really answer your question well, other than to say, ultimately, biology is in charge. On the other hand, you know, a couple of things are happening, and you already got one of them. In other words, she's saying, you're saying she doesn't, Jill, she doesn't understand. And that's good. That's good, because it means she's not frightened. And I don't know the chemical there. I really don't know the chemical there. But I'll bet you that there is a chemical that's somehow forcing that inability to understand what's really going on. And that's good. And when I give a lecture of this sort, I mean, not exactly the same, but I give this kind of lecture to the medical students every year at SC. And I have a slide that shows a whole slide where every single paper in the medical literature shows that this, you know, peace of mind and so forth, and all of those things are associated with prolonged survival. And then I have another slide that's equally as long that says these are the studies that show that they don't relate to increased survival. But no study has ever shown that doing these kind things has done any harm to any patient ever. And the studies that don't show prolonged survival, most of them do show some mechanism or some method of increased quality of survival, quality of life. Feel better. She says she feels fine. Take it. I don't know that I even ask her, how are you feeling directly? It's kind of a funny thing. It comes from my mom, and she taught me this. And I don't know if it's true of everybody or not, but you know, she was basically dying of cancer. And people would come in and they say, how do you feel? You look great. And you know, she didn't know how to respond. And so I would say, Mom, I know this is disgusting, but you just look great. And she actually did. But it was hard for her to answer it. And I don't know that I would, you know, any headaches, you know, I don't know that I would even ask that directly. But still, you got a good answer. And it sounds as if it was an honest answer. And so just keep going over there. You know, you're helping her. And whether you are able to help her prolong her life, or whether you're able to help her prolong the quality of her life, it's going to be one of those two. So
thank you.
Yeah. Well, maybe we got it. One last chance here. Any last question? Crazy or not? No crazy question. No bad question. Okay, so I truly appreciate your spending the time. And what I'll do next time is to actually explain what this immunotherapy, what this new immunotherapy is, and kind of how it works and some of the data and so forth.
Great.
So forgive all of my scientific slides, but hopefully
Oh,
the
You're
info got
wonderful.
through.
They were great.
Okay.
You're wonderful. Thank you. Thank you so much.
Okay.
Thank
Thanks
you
for
for letting me
Thank
be
you.
part of this.
Okay,
Thank you
and
so much.
thanks
you.
Gary
First
for doing
lecture.
everything.
Has this been recorded? Because I missed